What we're going to talk about today is lip reduction. Lip reduction is really just basically taking down an overfull lip and making it slightly smaller, as the name would imply. I usually do lip reductions in two particular circumstances. One is for an overly ethnic lip, perhaps African American, perhaps Asian, especially in the southwest Polynesian type of islands. There could be a higher likelihood of having more protuberant lips, and reductive procedures can at least efface some of the ethnicity of that look. The second indication that I have for lip reduction is someone that's had a bad previous permanent lip augmentation, such as with silicone. Now, I do a lot of silicone lip enhancements, and I have never yet to reduce my own lips that I've done. However, I've seen a lot of bad silicone done, lumpy, bumpy, putting too much in, and lips that are unbalanced. And oftentimes for corrective lip procedures, I have to first start by actually reducing the lip itself. Let me tell you exactly what is involved with the procedure of lip reduction. Essentially what happens is it's an office-based procedure. You come in here, and without any sedation, you can actually drive home afterwards. I do a really good dental block. The dental block does not have epinephrine in it, so it doesn't make your heart race. You don't feel any needles go in, just like when I do lip enhancement. You don't feel any burning or any discomfort, and within about 5 minutes you're very numb in that area. And then I go ahead and proceed and reduce the lip accordingly to what size that I need to reduce. Sometimes it takes about 2 times to get the lip in exactly the right size that I would like. At that point, I go ahead and close the lip incision with a suture that's dissolvable. So at the end of the week, I see you back just to make sure you're doing well, but you don't really need to have the sutures removed, which is really nice. There is quite a bit of swelling for the first few days. I usually ask you to take a couple of days off from work if possible. You stay on a soft diet. That's something where you don't have to chew food for about 3 days, such as yogurt, liquids and things of that nature, just so that you don't bite through the area that I've treated. I see you back, as I said, just a week out just to make sure you're doing fine. And again, it's an office-based procedure, which means you can drive home. I do give you some steroids for about 2 to 3 days. It's a couple pills that you're going to take, and that will just cut down the swelling. I provide that for you. You don't have to go get that at a pharmacy. Generally speaking, it takes about 2 to 3 months really for all the little swelling to go down. But I've noticed that most of my patients are quite satisfied even about a week to 2 weeks after the procedure, especially if it's done for corrective lip enhancement. For ethnic lip reduction, sometimes it takes about a month or 2 for you to really be happy with it. And oftentimes I think my patients are the happiest when it hits about 3 months afterwards. But it's a really minimal recovery time. I hope that explains to you exactly what lip reduction is all about, and I look forward to meeting you in consultation to talk to you more about exactly how this would be applicable for you.